Hi, Kerianne. Thank you for joining me as we're discussing medication therapy for mental health conditions. So after a provider prescribes a new medication for a mental health condition, our pharmacists play a vital role.
After you leave the doctor's office, the pharmacy is a lot of times the first place that our patients are going to visit. It can be a little uncomfortable, sometimes a little scary, and we want to make sure that we take care of them when they arrive.
So how do you care for a patient who may be apprehensive about starting a new medication for a mental health condition?
First and foremost, it's really important that our patients understand that even though sometimes our pharmacies are busy, the patient is our number one priority. It is our job to make sure that when they come see me, that they understand their medication and that they feel comfortable asking questions. If there's other people around, if it's super busy when they arrive, we often have a private consultation area that we can take the patient to if needed. Again, our primary concern is we want them to leave feeling educated and comfortable with the medications that they're picking up.
So when discussing medication therapy with patients for mental health conditions, what other topics come up?
It's important for patients to understand that medications aren't a one-size-fits-all solution for every patient. There's lots of different options, and sometimes it's trial and error to find the correct medication for each individual patient. So we want them to be patient with those and understand they might not be an immediate fix. It sometimes takes a little bit for them to take an effect. It's also important to remember that after they've been on those medications, come back and see your pharmacist again. You might have questions after a few weeks that you didn't have when you first started the medication.
Well, rapport is so important to the success of our patient's treatment, whether it's the provider who writes the initial prescription or the pharmacist that manages the medication therapy. We work together as a team. Often with medications, it can take time for them to work. And so it's important for patients to know they have multiple sources of information.
Absolutely. A pharmacist is sometimes one of the most accessible sources, and so we want them to remember that they can come back to us. But we also want them to know that we are one piece of their care team. They're doctors, they're pharmacists, we all work together to make sure that they're reaching the best outcomes.
So Kerianne, what other advice do you have to our patients or anyone watching our mental health video series?
One of the biggest pieces of advice that I'd like to offer is try to stick with one pharmacy if you can. The more complete picture a pharmacist has of your entire medication profile, the more accurately we can help you and make sure that everything is safe and works well together. If you do need to use more than one pharmacy, make sure you let your pharmacy staff know so that we can help identify issues that there might be in your medication profile.
Well, I agree, and I hope the information in this video series is helpful for patients to improve their health and wellness.
Keep in mind, medications are only one piece of the whole picture, Dr. Fick. It's important for our patients to understand that they're just one piece of the puzzle. We want to make sure they're getting enough sleep, that they're exercising regularly, that they're talking to their entire care team really to help achieve their best outcomes.
I agree. Mental health and the body are connected, and doing what you can to help with both will, in the long term, help with your mental health treatment.